So a facelift, and when we're talking about facelift, typically we're talking about lower face and neck. So what we're doing is tightening the layers underneath the skin, redraping the skin on top of that to help with any jowl formation, deflation in the face, nasolabial folds here. In the neck, we're addressing, I do a deep structural neck lift, which we're addressing deep fat, the platysma muscle in the neck, retightening that, redraping it, and also addressing glands in this area that as we're aging can become ptotic or sagging down and obscuring our nice sharp jawline that we had in youth. So it's very common to combine facial rejuvenation procedures. Oftentimes with a facelift, I'll combine a temporal brow lift or elevation of the brow here. In combination, we're lifting all of this, and so just lifting sort of the tail of the brow. In addition, eyelid surgery, blepharoplasty, either upper or lower, and then very commonly too, fat grafting. So as we're aging, not only are tissues sagging, but we're losing volume in our face. We're losing bone stock, and we're losing good fat that used to give us a nice, curve to our face. And so fat is very easily added to the facelift. We usually harvest a little bit from the belly or the thigh, and then just inject it in places where we're missing fat. So good candidate for a facelift. Really, as far as age, it's really just kind of when people are ready. I've been doing them in younger and younger people, as young as their 40s, because they're in the last, decade or so, we've seen a lot of filler, and sometimes filler done poorly. And there's a phenomenon called filler fatigue, that people are just afraid of having, too much. And so surgery, even though it sounds scary, can actually look, very natural. And if we reset those sagging tissues back to where they were originally placed earlier, then you'll just have a much more age gracefully, much more gracefully than your peers. Recovery time for facelift is, I usually tell people to take about 2 weeks off of work. We are in a compression garment that goes around the face. I tell people it's like a surgical ski mask. We're in that for a full week after surgery around the clock, and then after, my patients wear them nightly for 6 weeks. We get sutures out at 1 week, and then some that are behind the ear at 2 weeks. Usually, if you're working a desk job, you can go back to work and do fine at 1 week. You still may have a little bit of bruising and swelling. If you really don't want anybody to know that you've had anything done, then potentially like 2, maybe 3 weeks, sort of out of the public eye, but you could certainly work from home. So facelifts are certainly life-changing. They can take years off someone's appearance and are just so rejuvenating. People can look as young as they feel and really look and feel refreshed. And our goal is a natural, a restorative result, a beautiful, natural result. We never want anyone to ask, who did your face? Or what did you do to your face? We always want somebody to say, yeah, you look good. What kind of makeup are you using? What did you do? What did you do to your skincare regimen? Where did you go on vacation?